Okay, so we're going to be working on hip internal rotation. This will be demonstrated on the left hip. So this exercise can be often confused with stretching of external rotation. So to differentiate the positions, external rotation would be like this, where I am actually propping my left shin into an externally rotated position, not to be confused with location of the foot. As the foot comes in, my hip is actually rotating out. Hip internal rotation. I'm actually going to pre-position the leg either into neutral, that is where my shin is equal with the edge of the table, or slightly biased into internal rotation before I actually use my right leg as the buttress. So I'm going to come in and come over the shin. So it's almost, I imagine it more as like a pretzel. Okay? The next thing I'm going to do is I'm going to drop into a collapsed quadruped position. From here I'm going to slowly exhale and go into a posterior pelvic tilt. That is, I'm going to take my tail and I'm going to tuck it under. So I should be like rounding in my low back rather than stretching like that. From here, I'm going to take a deep breath in through my nose. Exhale. As I exhale, I double down on the posterior pelvic tilt by collapsing my abdominals, pulling my belt buckle towards my belly button. Additionally, I can get leverage by pushing my feet, increasing the pressure of my knee into the mat. That is, pushing my femur down will actually increase the tension in this posterior left pocket. I would sustain that sequence for about a minute. Thereafter, what I'm going to do is I'm going to actively try and contract the tissues that I'm stretching. So as I get into this position, I'm then going to increase, the motion is going to look like this, where I'm going to actively push into my right leg with my left. A little bit hard to appreciate when I'm actually in it because it's going to be an isometric. So I tuck, I feel the stretch in that posterior left pocket, push through my knee, and then I'm going to actively contract the deep buttock tissues on that left side as I push my left shin into the outside of my right leg. I'd sustain that for 30 seconds with a gradual increase in pressure over time. After my 30 seconds, maintaining the position, I'm going to slowly come out of it, unwind myself, sit back, reset, reposition. You can repeat for 2, maybe 3 times, but it's not so much how much I do in a single session, rather how frequently and consistent I am with it over time.